So good evening, everybody. I do want to thank you for joining us for our exclusive Ask Two Live event. To all of our panelists and our participants, we do thank you very much for taking the time to address these really important issues during such a time of uncertainty. We are going to get started in just a moment for a brief opening statement from all of our panelists. But first, Bill wants to lay out the ground rules for you.
Thank you, Dominique. Yeah, we ask that you all remain cordial and respectful at all times. We will first address questions that were submitted online and then answer questions that you have, the participants, the questions that you submit. Now, let's meet our panelists. I want to mention that if you're comfortable being on camera, in front of the camera, you can use the raise hand feature. Then a member of our team will unmute you and you'll be able to ask your questions directly over the screen.
That's right. And all participants will remain muted throughout the conversation, but we do want to hear from you. So you will be allowed to submit your questions in the comments section. So let's meet our panelists, Bill.
You got it. Joining us today is Chief Executive Officer with Hope Clinic, and that's Dr. Andrea Karaskostas.
Hello. Good afternoon.
Hi, good afternoon.
Thank you so much for having us and inviting us here for this conversation. I'm the Executive Director of Hope Clinic. I'm a physician by training. I've been with Hope Clinic for 12 years and been practicing medicine for 25. Very passionate about access to healthcare and providing the best care to our patients. Our clinic is one of 9 FQHCs in Houston. We serve the southwest corner of Houston. We are particularly known for our language capacity. We provide care to our patients in 25 different languages. We serve about 140,000 patient visits a year, and we deliver our own babies, about 1,500 babies a year for our area. Thank you.
Amazing. Thank you, Dr. Karaskostas. We appreciate it. Next up is Medical Director of Pediatrics for Legacy Community Health, and that's Dr. Tamisha Jones. The floor is yours.
Hi, thank you. I'm so glad to be here, and thank you for inviting me. I'm excited to talk about this topic as well. I am, as you mentioned, the Medical Director of Pediatrics at Legacy Community Health, which is one of the largest federally qualified health centers in Texas. And we serve all of the greater Houston area and Beaumont and Baytown as well. We also have 27 school-based health clinics where we partner with KIPP and Yes Prep and Galena Park ISD. I've been the medical director of pediatrics for the last almost 5 years, and I've been with Legacy Community Health for 8 years. And we pride ourselves for accepting all patients, regardless of their ability to pay. We have all service lines, OB, pediatrics, adult medicine. We have a large behavioral health department, and we have dental, we have vision. We are the true medical home. And so I'm excited to be here and participate.
And we feature you guys quite often here on Channel 2 and all the
services
thank you provide. So thank you, Tamisha.
That's fantastic. Next up, we have family physician and chair of the Clinical Sciences Department at the University of Houston College of Medicine, and that's Dr. Brian Reed. Welcome, Brian.
Hey, thank you. Good evening. I'm Dr. Brian Reed, and chair of the new U of H College of Medicine, and we have a federally qualified health center on campus. It's a Lone Star Circle of Care. We also collaborate with Hope Clinic, that is the home of our U of H HCA family medicine residency, as well as our OB-GYN residency. We have an affiliation agreement with Legacy, and we plan to send our students there in the future. We, in addition to have clinical practices at on campus with our FQHC, Lone Star Circle of Care, we also partner with the Harris Center for Mental Health and IDD and provide primary care for them. My background, I've worked within Harris Health System, volunteer at the San Jose Clinic, also have worked at Harris County Public. So very familiar with many resources in town for people that don't have insurance.
Excellent. Brian, a flashback when I was a student at U of H, I got my first pair of reading glasses at the U of H medical facility there. So I thank you. It takes me back. Excellent. Okay, next up is family nurse practitioner Melissa Herpel with Express Family Clinic. Melissa?
Hi, again, thank you so much for having us. Yes, my name is Melissa Herpel, and I own Express Family Clinic. We have 3 locations, one in Conroe, one in Spring, and one in New Caney, so all serving kind of North Houston and Montgomery County. I've been a nurse practitioner for 13 years, and I've owned Express Family Clinic since 2011. And our clinics particularly serve patients who are either underinsured or have no insurance at all. We have a flat office fee, and we see everyone who wants to be seen regardless of their qualifications. If you want to be seen, you come on in and we get you seen that day. No appointments necessary. I joke around all the time and say it's called Express Family Clinic, not Slow Family Clinic. So we get you in, we get you out, and we get you taken care of. And that's what we do every day.
That's awesome.
Good to see you, Melissa. And up next is a friend of mine, a guy that I've worked with for years on stories, and he is a genius when it comes to hospital billing. He is the founder and chief science officer of Neurodiversity Foundation. It's Sean Fry. Sean, you have the floor. Take it away.
Thanks, Bill. My background is in hospital administration. I was the chief information officer of 3 different hospital systems. And I transitioned from executive in healthcare to building my own healthcare analytics company. So I had the fortune and the purview of being able to see hundreds of different hospital systems and their billing practices, their care practices. I helped build that system. So I really had an internal view of how healthcare really works. And I've since sold that company and have a private foundation. And I spend the rest of my life for patient advocacy, finding out how people to get the best treatment available globally, how to find ways to fund it, really what the burden is on healthcare, why it's so onerous on patients. And now taking my experience, now that I no longer work for hospitals, and speaking out against ways where people can get a benefit for their families and their employers.
Great. What a nice array of panelists we have here tonight. I'm going to launch into the first question, and I will open it up. Whoever feels that they want to handle it can jump in and go for it. But the first question is from Lakeisha J. It's to any of you. And her question is this: during these unforeseen COVID-19 times, as many people are becoming unemployed, health benefits are more and more vital. COBRA insurance is excessively expensive, and even more so for a family to obtain coverage. Many are stating that the requirements for the Affordable Care Act excludes many people. So her question is, what are some additional health benefit options available to those who can't afford COBRA and they don't qualify for the Affordable Care Act? They're in between.
Yes, I'll take that question. I think that for your immediate needs, certainly clinics like Legacy and Hope Clinic are always there for you. We charge on a sliding fee scale depending on your family size and your income. So, and even if you qualify on the larger income, for example, at Hope Clinic, we charge $30 up to $85. And if you fall somewhere in between and you still can't afford it, either Legacy or Hope, we will always work with your income, either in payment plans or reducing your options to get care. Of course, there's Harris Health, and Harris Health has a very generous program as well, where you can get enrolled and get care there, also on the sliding fee scale. And so those are the 2 big options that we have here in Houston. November 1st is open season for the Affordable Care Act, and that's a good opportunity to revisit that.
Great. And Tamisha, did you want to chime in at all representing Legacy?
Yeah, thank you. And yes, I agree definitely with Dr. Kirkos. Just, that we're lucky in Houston that we have a lot of options, and Hope Clinic, Legacy being some of those options throughout the city. And yes, the same thing. We have a sliding scale. We have grants. We are going to do our best to see you. We know that these are tough times. Tough times on top of tough times with the COVID. And so we are prepared to help you get seen regardless. You're not going to get turned away. You're going to get seen, and you're probably going to leave with some kind of funding, actually, because we really do work hard to find funding for all of our patients, regardless of, your ability to pay, or, sometimes you fall in that bubble or the donut hole, and it's healthcare can be quite expensive, and there are some options to work with you.
Good deal. I've got a question here from Andrea N., who wrote to us, says that she works, but recently lost her apartment. So she is now, unbelievably, living in her car. She wants to know, can I still get medical assistance, even if I don't have a home address? And again, anyone can jump in and answer this.
So definitely, yes.
Yes.
You don't need to dress. I think that that's probably true of many organizations, some of which are represented here. So this is why we're here as a facility and an organization to provide healthcare to Greater Houston, regardless. It doesn't, insurance or no insurance, living in your car, homeless. It really doesn't matter. Our goal is to really provide quality healthcare at an affordable cost, depending on, like I said, sliding scale, or we're going to get you seen. We just want to provide additional access points, and that's what's important.
Dr. Reed, did you have something you wanted to add to that?
I do. When Dr. Jones mentioned grants, there actually are a couple of grants out there or funding sources, particularly for women. The state of Texas offers the Healthy Texas Women's Program. So depending upon your income, you might qualify for that, and that doesn't matter where you live. That's sort of statewide. There's also a family planning grant that's available for both men and women if they're interested in the services. So that may allow them to get a complete physical. And in addition to Legacy and Hope, we also have Vicino, El Centro de Corazon, Spring Branch FQHC, and several others. There's a Texas Association of Community Health Centers that can help you find a community health center in your area.
I'd like to add one thing to that is, speaking for hospitals, there are many people that don't know that literally we cannot turn you away. If you did come to us, and particularly with COVID, I've worked with a lot of people who were afraid to go to the hospital either for fear of infection or for fear of cost, who had reached a relatively acute or serious level of illness. You can go to the hospital. We will not turn you away. You will be seen, you will be treated. And if you are in one of those gaps where you're living in a difficult situation, you can ask for a hardship waiver that can defer a lot of the costs or eliminate them. So there are options there. Communication is key with hospitals, as well as the physicians. Let us work with you from the administration side. We do have a heart, even though sometimes it doesn't seem like we do.
And we actually at Legacy, we have a really robust social determinants of health program where we ask these questions about homelessness, about food insecurity, and we have resources to help direct you so that we can try to get, as far as we want to provide good healthcare, but we also, health is of many things, not just, what's happening with your physical body, but also about where you're living and how you're eating and all of those sorts of things. So we want to be able to take care of the 360 degrees of you.
I think you helped a lot of people with those answers, team. We appreciate it. I want to move on to our next question. It's from Fatuamata, and she says, I lost my job. How can I get insurance for my children?
Certainly, the easiest thing, of course, right now for children is try to enroll them on Medicaid, especially if she lost her job. It's an important time to get them enrolled. They can get enrolled in any of our clinics. Most of our clinics have the ability to enroll onto Medicaid directly and track that enrollment. So I definitely encourage you to Google, find my community, a health center, find a health center, and you will find a link to a federal government website where you just enter your zip code and it will show you the clinics closest to your house. If you speak Arabic, certainly Hope Clinic is your place to be. We have plenty of providers that speak Arabic, and our staff speaks Arabic that can help you enroll on all these programs.
Hey, that's great. I've got a particular question from Nancy T, and it's an interesting question. She says, there are companies that claim to charge less if you pay cash. Is that the way to go, or should you go a different way? And I know that Melissa Herpel is an expert on this because that's how she operates her business. $50 for a visit, correct, in cash?
That's correct. I mean, it really just all depends on what's going on. I think cash clinics can certainly be helpful because is just a set fee for everything that you need. But it's important that when you go to a clinic, even if it is a cash clinic, you make sure that the providers are well aware of alternative healthcare for them and know that there's a place for them to go if they need additional healthcare. So it's really easy to walk in somewhere, get treated for your high blood pressure once, but who's going to refer you to a cardiologist? Who's going to make sure that you're keeping up with your care and your medications and all of the preventative maintenance that goes along with that? So it's important that these cash clinics have the resources that Hope Clinic and that Legacy Clinic also provide. So knowing that they can be referred out if that level of care does reach somewhere that definitely needs a little bit more specialization.
Melissa, I think you touched on this a little bit, but this question from Jennifer says, are there options when it comes to seeing specialists like neurologists? And what about those big tests that you might need, such as an MRI?
Well, actually, what's funny is I have contracts with different radiology groups all over the city of Houston, so that I can actually get you a CT scan for less than $200. I can get you an MRI for less than $300. So you don't necessarily have to have insurance to go get these tests done. Ultrasounds can cost $50 to $75 if you can find a place that I've contracted with to get that done. Same thing with labs. Labs don't have to be astronomical. I contract with LabCorp in order to get those prices down, and then I pass the savings on to my patients. So they don't have to worry about qualifying for anything, because there's a lot of patients who fall within that other gap where I can pay for my home, I can pay for my car, but I can't pay the $2,500 a month it costs to cover my family's insurance. So now what do? They're without insurance, but they have means to pay for other things. So that's kind of where we come into the mix and kind of help families out that way with different cost saving strategies for them.
Fantastic. Hey, we've got a question from Freddie G. He says, and I quote, "As you know, President Trump has reduced the penalty for noncompliance with the individual mandate to $0. As a result of this, have there been any new and innovative insurance products that have become available that maybe don't comply with the ACA standards, but nonetheless still provide quality medical insurance to otherwise healthy individuals?" A very good question. Anybody willing to answer that?
I am not aware of any new products except for, some of the emergency or urgent catastrophic insurance plans that are out there that will cover just catastrophic events. And so you're covered for hospitalizations. And I'm not sure what the definition of catastrophic may be different for every single one of them. However, I think that it's always important to stay healthy and not wait for the catastrophic. So, early pap smear, early prenatal care goes a long way. So the best insurance for catastrophic events that you can have is early access to life-saving, preventable, continuous care. Hey,
I got to jump in on that because I actually know of a company called Sidecar Health. I don't know if you guys have heard of this. I know Sean has. I did a story with them, and they do offer a unique insurance model, a unique insurance product that is meant for people who are essentially the more healthy people, because the healthier you are, the less health care you need. And so you don't need a ton of insurance if you're younger, of course, and you have very few health problems. There's a lot of people that don't want to shell out this giant, insurance bill every month. So they can maybe look at an organization like Sidecar Health. In other words, and also for people that don't have the money to buy an expensive insurance plan, Sidecar is an option. You are given a limit as to how. You're given a dollar limit as to how much coverage you'll get. And that going in. You can buy, I think it's $10,000 worth of health insurance, $25,000 worth of health insurance, all the way up to maybe $300,000 worth of health insurance. But each one of those levels costs a different amount. And of course, the lowest priced one is the $10,000 coverage per year. But it is an interesting product. Do you know about that, Sean? Do you want to chime in on that a little bit?
I do, right. So there are different products. There's those that are regulated by the Texas Department of Insurance, and there are programs out there that are medical sharing programs. Examples of these would be Samaritan Health or Christian Medishare, where you can subscribe to programs and they will pay your bills. The problem with that is you may not get all the providers you want to get, and you may not have, depending on what level of illness and your acuity level, you may have difficulty with it, but they are a very good baseline coverage program that basically negotiate the cash price. The one thing, back to Melissa's point earlier, having insurance is not necessarily the cheapest way to get healthcare. And in many cases, it artificially inflates the cost of everything, as Bill, you and I have proven out multiple times. In regard to pharmacy and even surgery, you can get a better price. Like Melissa was telling you, the reason I have to charge so much for an MRI or an X-ray is because I am required by law to offer everybody the same price to the insurance companies who operate on discounts. If you don't need that discount and you just want to pay cash for it, oftentimes you can buy any service, any surgery, any x-ray for a much lower price than you would be by involving any insurance carrier.
Yeah, that's right. And, you know, Sean is an expert in negotiating as well. And he says that, that patients, all of us, we actually need to try and negotiate now and then with the doctors and the providers that we're dealing with, because in many cases they will negotiate with you if you just make the effort. A lot of people think, well, I can't do that. The price is the price is the price, but that's not true. Correct, Sean?
Correct. Not the gracious people who I love what they do that are on this panel are not the people that you need to negotiate with, but the bigger facility. Just so we're clear, they are operating. Hospitals have a really hard time operating with their budgets and things like that. These practices, but the bigger systems in town, the Methodist, Memorial, HCAs, they have margin for error. What you really want to be careful of was when you get into the specialists, have their own systems, their own oncology centers, their own imaging centers, things like that. That's where you can get into a trap, where some of them will charge you out of network rates and charge you rates and balance bill you. We covered that as well, Bill. Those are the places where your resourcefulness is your key at reducing your healthcare costs. Many people pay bills that they don't even owe, simply because they don't know better and need to ask questions. So we can follow up with that after.
I'm glad you touched upon that. And Bill, maybe you can get a link to your story and include that in this so that people can learn more about what we've been talking about.
Yeah.
I do want to remind everybody that you guys can submit questions in the chat room and by using the raise the hand feature as well. We did receive a question from our chat room. It's from Carrie. And I just saw another question just like this. So it's really two people we're answering. Carrie was wondering, is there a sliding scale clinic south of Houston? And then I saw somebody ask the question for Fort Bend County. So would anybody on the panel know that?
The question for Fort Bend, go ahead, Brian.
Yes, I put in the chat box the Texas Association for Community Health Centers, that website. So you can just type in, find a community health center. Depending upon how far south of Houston you're looking, I know Alvin, there's the Alvin Community Health Endeavor. Pasadena has a Pasadena Health Center. There are, I'm forgetting the name of the Fort Bend County does have one. It's
Access Health.
Access Health. And then San Jose also has a place out in, I want to say, Richmond and Rosenberg.
Katy has a couple of places too.
Yes, yes. I wanted to mention another model. There's direct primary care models that are out there that may be an option. It's almost like a subscription service where it's not insurance, but you're paying the primary care practice a monthly fee. And you have basically 24-hour access to the physicians, and you can get discounted labs, discounted immunizations in that. So, you know, it covers at least the primary care needs. And they also do a lot of virtual visits. You still would run into trouble if you got really sick and needed to go to the hospital. So that's why you want to have some sort of catastrophic insurance in case you get really sick, because of course, healthcare can be very expensive, as you all know. And some of these direct primary care practices also negotiate with some specialists that they refer to. So sometimes they're able to get discounted rates with those specialty services as well.
Interesting. Hey, I think we've got a very interesting question here from Yvette C. She asks, is there affordable insurance options for undocumented people, the undocumented population here in Houston? Can somebody answer that?
Unfortunately, I don't know of any insurance products that I think some of the private insurances maybe used to be willing to take patients without necessary social security numbers, just with their own passport information of their own country. However, certainly not the ACA or Medicare or Medicaid. And for that population, we certainly have our community health centers and, you know, a lot of cash clinics that are available.
Dr. Karakostis, oh, I'm sorry, go ahead, Tamisha.
It's okay. I was going to say that also, you know, just federally qualified health centers, that's one of the things that we do is that sliding scale, and really being able to provide healthcare for even, regardless of your status. I know a lot of families are with the public charge are afraid to come into the clinic. They think that somehow, that's a place where it might be unsafe, but we really worked hard to make sure that families understand that they're safe in the, when they come to our clinics, and that that's why we're here. We're here to serve everyone. We know we're all in the same boat. And so rise or fall together. And so we have to do a good job of taking care of everyone in our community. And so knowing that there are options available, some grants, sliding scale, you come in and we're going to see you, we're going to take care of you, regardless of your status or your ability to pay again.
It's kind of interesting. We get a lot of patients who, definitely a lot of Spanish speaking patients. And what's funny is you'll see like the mom come in, and when the mother of the family comes in, everything's fine. And she's like, I can trust you guys. You guys are going to do anything? No, of course not. Then the kids come in, then the husband comes in, then the grandparents come in. And so we end up seeing an entire family in the course of a week. And we have a bunch of patients who actually have family coming from other countries to help them out with their kids, or to come visit, and they stay for 3, 6, 12 months, sometimes even coming from places as far away as Africa. And they have no other way to get their refills on their medications that they got when they were in their other countries. And so having the ability to just come in, get taken care of, not get 1,000 questions asked about this, and that, being able to just pay $50 for your office visit is just a great relief to a lot of patients. And again, just adds to the accessibility that everybody has here on the panel as well.
Great.
I want to say one thing about this. If you are severely ill and you think that you have an immediate need and you can't necessarily get to a family health center, urgent care centers around town, there's several different ones that cover most of Houston. Next Level Urgent Care is one of those examples. Even if you have a broken arm or a broken leg, if you come to a hospital, you're looking at a cost of about $1,500 to $3,000. If you go to an urgent care center, which closes at 9 p.m., so you have to tell your kids, I always tell my children, if you're going to hurt yourself, do it before 9 p.m.
Normal business hours.
Yeah.
Normal business hours. Then you can walk out for a cost between $150 and $200. It's it's 10% of the cost, maybe less. Even if you come to a hospital, we're not going to operate you on that night. We're just going to bandage you up and send you on the way. The doctors can confirm. And you could save yourself a whole lot of cost. A $200 bill fixed cost is a whole lot better than getting bills in the month bills every 2 weeks for the next 3 months. So
I'm glad you added that, Sean. Thank you. We have a question from Tara to everybody. She's wondering if the community clinics that you represent have the means to provide chronic condition care. She says she goes to a pain doctor, rheumatologist, allergist, physical therapy weekly, Remicade infusions every 6 weeks, which is in addition to PCP, gynecologist, dental, vision, et cetera. She said just got hours cut so low that she said she had 10 last week, consider leaving for a private job, but wouldn't have insurance. So she's wondering if the community clinics cover things like that.
Yeah, well, we are primary care clinics, and we really focus on primary care, meaning, gynecology, pediatrics. We have behavioral health services, dental, vision. Some of the more specialty clinics like immunology, rheumatology, we may have access to some of the consultation where our primary care doctors can co-manage your primary care needs. But if you need infusions and you need more intensive care for chronic conditions like that, unfortunately, at least Hope Clinic does not do infusions. And at this point, I think Harris Health is the most robust care that you can get when you have those types of needs. Tamisha, if you have anything to add.
No, I would just say the same. And we have some wraparound services for sure, as far as dental, vision, OB-GYN, and then of course, any other primary care needs. But when it comes to those specialists like rheumatology, that's going to be outside of what we have within our clinic system. So again, we can always offer resources, and we have some partnerships and collaboration, but it's not something that we have internally. And I agree that Harris Health is probably one of your best bets there.
And Tamisha, can you go down the list of different services you offer there at Legacy? There's a lot of them. Name them off for them, will you?
Yeah, so we have adult medicine. We have, and within adult medicine, we actually have special geriatric specialty. We have pediatrics, and within pediatrics, we have actually developmental specialty, and we have adolescent specialty. We have OB-GYN. We have behavioral health. We have a very large behavioral health program with psychiatry and therapy. We have dental. We have vision. And then we have, our public health team. We also have our patient education team. We have nutrition. We have a lot of the kind of wraparound services that help to provide really, really good primary care.
Yeah, and Tamisha, also you obviously you have several pharmacies located in some of your legacy centers, and those pharmacies offer ridiculously low prices, correct?
Yeah, we do. And we love our pharmacy, and we have that ability to do clinical pharmacy as well. We have a very large and robust HIV care as well, a program for PrEP. And so, yes, we love our pharmacy. It's fairly new within the last couple of years, but it opened the doors for us and really allowed us to offer low cost of pharmaceuticals to our patients and really convenience as well, so you don't have to leave.
Right. Brian, I think you wanted to chime in?
Yeah, I was just going to add, we hadn't highlighted the behavioral health services that these federally qualified health centers. So we have therapists, we have psychiatrists. Someone asked in the chat box about TB testing. I mean, all of us do the TB testing. That's readily available.
Yeah, I would add that certainly not only do we do behavioral health, but we have a really seamless integration system with behavioral health. So when a patient comes and let's say it's a postpartum woman and she's sad, depressed, she doesn't have to have a referral and send out to another doctor to deal with her depression. She will get right that same visit, that second, someone else walk into the exam room that is a certified therapist that will be able to help her immediately. Like Legacy, we do have all the same services as they do. And certainly behavioral health is very important.
Very good. There's another question, this anonymous question that one person wrote in with, saying that if you're considered below the poverty level, which this person is, he or she wants to know, why don't I qualify for Medicaid? I'm currently not working and my daughter is working part-time to pay our expenses because I have cancer. I applied for Medicaid, but I don't qualify. What resources are available to me?
Well, that's a tough one. So Medicaid varies from state to state, and our thresholds for income in the state of Texas are so low that very few people that are not pregnant or a child, qualify for Medicaid in the state. So other services, so the FQHCs would be happy to see you in terms of, sliding scale payments. And depending upon what county you live in, there may be a hospital district like Harris Health System that would be able to see you and provide those services. Now, most hospitals have like an emergency Medicaid if you have to be hospitalized because of the cancer. So.
Well, it depends which cancer you have. There are waivers on Medicaid for breast cancer, which make you eligible with a higher threshold of income. And there's always your ability to appeal the Medicaid resolution. It also sometimes depends on who helps you fill out the application. If you're declaring your daughter's salary and your household, and it seems like you have someone that's responsible for your bills in it. So certainly you need a good case manager that's going to look at your case carefully and fill out the application correctly. Sean?
Exactly right. So this is more in my expert, and I will not get into policy, but sometimes things that can trip you up from getting on Medicaid are something like owning your own car and things you declare, which you could actually sell your car and get on Medicaid and be better off and take the bus, sell the car to someone else. And there are ways to get around that. Just dig deeper and communicate. There are caseworkers at every hospital and these health centers that will help you on those programs. That, don't give up just because they said no the first time. As again, appeal your position, keep up, especially in your situation. My heart goes out to you. If you drop your name, I'll try to find some resource that you can use to find out to get you to qualified so you can get the care you need.
That would be a big help, Sean. Thank you for adding that in. This question from Sherry is really poignant because of COVID-19 this year. And she's saying with the social distancing, a lot of people have not been able to get to their appointments like they used to, or have chosen not to out of fear, or the appointment wasn't there because, systems were not available. So she says, rather than delaying care, what is your recommendation?
Virtual appointments. I think there's so many people have really moved into this virtual world, including my clinic. I mean, we've got 3 little locations, little people, and we have tons of virtual appointments because we know how important that is for patients in the community. And I think just about every system has really developed some type of virtual appointment for you so that you could get at least some type of care, be seen face to face with somebody to guide you to that next level of care. So please, 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 please do not hesitate putting off refills of anything. Do not hesitate to call someone or do a virtual appointment if you're having any type of pain or any type of problem. I know most of us probably saw this, right during the May, June area the 911 calls for arrests just went up so much because people were just sitting at home without their medications, and they were having CHF exacerbations, and they were having heart attacks and strokes at home because they didn't want to go to an ER. They didn't want to go into a doctor's office. So I don't want to start to see that happen again. And I love that everybody's really moving to this kind of virtual world and these virtual appointments. So definitely take advantage of them. I know we are.
There's nothing that will reduce the cost of care greater than early intervention, whether it's a chronic condition like hypertension, diabetes, or even the onset of colon cancer or something like that. The earlier that we begin treatment, the lower your cost of care. Or an acute condition, if you start having a difficult time breathing, chest pain, or any of the symptoms that would indicate stroke, heart attack, or anything like that, get to where you can receive care as quickly as possible, whether a family qualified health center, urgent care, emergency room. Your cost of care will be greatly diminished, and people will work with you on the backside.
I would say virtual care, yes. And I would just caution, though, that there are lots of virtual care that's opened up now. So quality does matter, and making sure that it's a trusted source for virtual care. Legacy, we have virtual care too. We ramped up very quickly during COVID. And it's our own physicians. So we don't outsource our telemedicine. We actually see our own patients. And we have some other services that go along with our telehealth, like what we call our fast track labs. So if you need a rapid strep test, if you need us to check your urine, we can do that. And that's really part of making sure that we're continuing to provide really good care and not just kind of checking the box and saying we did something that we really didn't do. And so just making sure that who you're seeking your telehealth through is really important too. It's really important to your healthcare. And then I would also say, aside from telemedicine, real live in-person medicine for your children is important because their preventative care includes vaccines. And while we all understand that COVID is scary and we want to try to protect ourselves as much as possible and our children, we don't want to end up in a situation where we're fighting COVID and measles and pertussis. And so we know that there was a huge drop in immunizations during the early quarantine. And if the fear is that we would drop below what's required for herd immunity. And herd immunity really is when enough people have a vaccine and are protected, that they protect the individuals who can't protect themselves because of youth, like babies that haven't yet been vaccinated, or diseases like cancer that makes their immune systems low. And so we want to make sure that our children are protected and that our community is protected. And again, this is trust. So this is what's really important about and so great about federally qualified health centers is that we are a medical home. And so we really do try to make sure that we are a trusted source of healthcare for you and that we can provide a safe place for you to bring your children to be vaccinated. And just to come in, if you prefer to come in, we want to make sure that we're providing you the opportunity to come in and feel safe and be safe, and lots of opportunity to do other things as well, whether that's just telemedicine or telemedicine combined with drive-through labs. We want to be able to be there for you, whatever your need is.
Very good. Excellent answer, Tamisha. We have a question from Ben K, who asks, how has the Harris County HD Gold Card succeeded or failed to provide care to low-income Houstonians during this COVID-19 surge? Maybe that's a good question for you, Brian, or anybody wants to jump in on that.
So I don't work for Harris Health anymore,
yeah,
but I
well,
stay connected to them. I know they were challenged by the surge. They had to actually temporarily close or curtail some of the services at their ambulatory centers because they were pulling so many people over to serve the people in the hospital. And that, and that was the concern all along, is that we would have so many people sick that we would not have enough people around to, take care of everybody that was hospitalized. So I know that hindered some access. And, fortunately we have, in addition to Harris Health System, federally qualified health centers that are part of that safety net. I mean, we were definitely all stressed, during that time, and hopefully we won't see a second wave as big as the first wave.
So from Harris Health point of view, since I'm on the board of Harris Health, I have to say that they've been true heroes. They have really pulled staff to go into hospitals, but they also have beefed up their telehealth care to an amazing level. At some point, they had almost 40% of their patients via telehealth. And so they put all the resources they had to still be able to provide care, outpatient care to their patients, the same way that Hope Clinic and Legacy did, using technology and using all the resources they had to still take care of their patients. So I think we in healthcare, we are made for this. We really pull together all our resources and all our wit and all our intelligence when it comes to a disaster, and we work together to address that.
We've been having a nice conversation about virtual care, and it prompted a question from Beverly, and it's to anybody. She says, how can one access virtual appointments if they don't have a smartphone and don't have a computer?
So there was a time when we were doing telephone visits, and that's still something that's possible for sure for those families that don't own a phone or a computer. Most times nowadays people have some sort of device, but we recognize that that's not necessarily always true, and so we're able to make the adjustment to do telephone visits if we did as well.
I do have to say that our clinics, and I speak for Legacy as well, we have gone through great lengths to make sure that our patients are safe. And so we have redesigned our waiting rooms. We have redesigned our scheduling. We have opened additional spaces to make sure that the patients who are waiting and seeing a physician are safe. And so and also, of course, to protect our own staff. So I can tell you that our clinics are really safe. So if you don't have a smartphone and you can walk into one of our clinics and still be pretty safe.
I get to chime in for a minute about that, because I've been to Legacy just recently last week, and yeah, the glass shields were up. The waiting room looked almost empty when I walked in, but when there were people there, they were spaced out a good 10 to 12 feet away from each other. They take your temperature when you walk in, and the same when I go to my own personal doctor within the Methodist health system. I walk in the door, and the first thing they do is, take your temperature, make sure that you are not feverish, have any kind of a spike at all. And then they, again, in the waiting room, they have us spaced out like 8 feet away from each other. They only allow a certain number of people in that room at a time. I think at my doctor's office, there's 4 of us allowed at once, and that's it. And it's a huge waiting room, and only 4 people are allowed in there. And then when they call your name, you don't touch any doors or anything. They hold the door for you. You walk in, sit down. The doctor enters the room, and he doesn't come close to you except if he has to, basically, check your heart or touch you with an instrument. But other than that, I got to agree. It's the medical profession has found a way. Even as close as they have to be with you at times, they have found several different ways to protect you. Would you agree with that, most of you?
Definitely. I mean, it's so important for people to feel safe to come in when they're coming into the clinic. I'm a pediatrician, so I'm always going to talk about kids and how important it is to bring kids in. It's really hard to do. We can do lots of telemedicine over the phone, but some things You know, we have to see the kids in person. And it's really important for families to feel safe. We have to keep our vaccination rates up. We have to keep those immunization rates up. And in order to do that, patients and their families have to feel safe, and they have to be safe. We have to be doing things to keep them safe. We know that many times families are bringing in their healthy children, or adults coming in for well visits are healthy. And the point is that we want you to leave healthier than you came. You came to get preventative care. You came to get checked up. You must leave healthier. We cannot have you come in healthy and leave sick. That's unacceptable. And so we do work really, really hard to make sure that we are following, CDC guidelines to the letter, and making sure that there is physical distancing, that we're doing masks wearing, that we're doing everything we can do to make it a safe space. One of the safest spaces that you'll probably go into in public.
Thank you for adding that. Boy, this hour is flying by. We have just about 5 minutes left if anybody has questions that they want to have answered. One that is here is addressing the question about low-cost insurance for hardworking small business owners.
The gap in healthcare is one of the gaps are the people obviously who fall near the poverty line, who qualify for Medicare and or Medicaid, right? You're not old enough for Medicare. You're not poor enough for Medicaid. But the other gap would be small business owners who do not qualify for employee-sponsored benefits. And the difference between an employee-sponsored benefit plan and an individual plan, the disparity is great, and it's very onerous upon them. They are the people that truly need to be the most resourceful. Since in many cases, if you are healthy, having a high deductible plan for catastrophic care will guarantee your family is treated in the event of an emergency or a critical illness. That is the best option you might have to protect your family. But ultimately, the best use of services, by the time you pay your premiums, your deductibles, your co-pays, and things like that, people don't really pay attention to their overall cost of care, and they have no control. How much physicians get paid, how much hospital gets paid is all controlled by insurance companies. It's not the doctors that are artificially inflating the price, or hospitals even. It's the insurance companies. So use your own resourcefulness, find these facilities where that you can pay cash for everything you can. But if you're not going to have a real big cost, if you pay a lot of insurance and don't use it, you've wasted a lot of money. If you use your money wisely, because I know we're limited on time, you're better off negotiating your own services with these kind physicians who will help you navigate the process than trying to find the best insurance plan that's going to cover everything. It just is not going to work out in your benefit as a patient.
Yeah. Bill, do you see this question that just came in from Veronica?
Yeah, that was interesting. Veronica wants to know about Medicare. I believe she wants to know about Medicare. She's like 65 years old, wants to know if her 19-year-old son will be covered as well. Can someone answer that?
I don't know much about insurance, but I know that they will not be covered.
Unless they are disabled, unless they meet some threshold that would attribute them to they've got to be disabled in a way, classified clinically as disabled in some way. They may be able to qualify for an early Medicare, or they might be able to qualify for Medicaid, but typically not.
One other thing I wanted to mention, I think any one of you can chime in on this, but there are so many new innovative ways of giving people services at a lower price, and particularly one that I know of is MRIs and imaging work, CAT scans and MRIs. There's one company here in town that has reduced the cost of those things to you can get an MRI, for example, for $125 to $150. Again, this is paid with cash and not through insurance. But these, there are some entrepreneurs out there that seem to be breaking the rules, breaking the mold, and coming up with a way to offer lower priced services. To any of you in the group right now, can you give us some tips, some places people could go right now to get a lower cost shots, lower cost MRIs, lower cost tests?
I think that's going to be your FH, QCs. That's going to be your federally, qualified health centers. And then there's a lot of clinics like mine out there. There's a lot really good people who have opened up clinics that really cater to patients who either have high deductible insurance or no insurance at all. I see a ton of small business owners. They come in daily. Just they can't afford the insurance. What do we do? Insurance really has done a lot for a lot of not good things, really, but things like shots, a steroid shot, for example. You go to, a regular doctor's office, or you go to the hospital, you're going to get charged hundreds of dollars for a steroid shot. That steroid shot, honestly, it costs $2.49. So I charge 15 bucks. You don't have to go crazy and really go expensive on a lot of these things. Strep tests. A strep test costs $3. Why are we charging $50 for a strep test? It costs me literally $3. So I charge 20 bucks instead. And just like, Mr. Fry said, it's so important for you to advocate for yourself, to check out these places, do your due diligence, just like Dr. Jones said. Just don't go to any, fly on the wall just because it says $10 and everyone flocks there. You really need to do your due diligence. Make sure that it is someone who is licensed in the state of Texas, somebody who's certified, and somebody who really has a good reputation for doing the right thing for patients all over the place.
Thank you, Melissa. I think you guys have really... I'm sorry, go ahead.
Last thing. What Melissa just said, by putting your prices out there, lets you know what you can expect. People that won't tell you what it's going to cost on the front end. Physicians need price certainty, know they're going to get paid. Patients need price transparency to know what things cost. It could radically change the cost of care, like she talked about for a strep test. And what Dr. Jones was talking about, a urine drug screen, I've seen the price go anywhere from $50 to $15,000 for the same urine drug screen for one. Yep. So do your due diligence, ask for the costs. I know those are the ones, that's the bill you get in the mail, and there are thousands of them sent every year. So ask in the front end. Yeah.
So I just, as a last pitch, I want to say, again, preventive care is the best insurance you can get. Most of our FQHCs, our clinics like Hope Clinic and Legacy and others, we have special prices. We charge $20 for a mammogram. We have special events that we do where we'll just do pap smears and charge $20 for the pap smear for that day. Flu shots, you get them. Most of our imaging is free. We have amazing prices for our pharmacy products, just like Legacy. And so we are interested in keeping our communities healthy, because the way to make money is to see a lot of healthy patients that are not going to use a lot of resources. And if you can keep your employment, you can be employed and be healthy, that's the only way you will pay us. So we're really interested in keeping our communities healthy at home, working so that we can all succeed together.
As you're all giving us your closing statements, we want to wrap it up. I think Dr. Jones, Dr. Reed, and Melissa, all of you can chime in as well. We'll start with you, Dr. Jones.
So I just want to say that there are a lot of options for anyone, whether you have private insurance, no insurance, you're undocumented. Really, the main thing is just take care of yourself. Really, during this time of COVID. Know that there are places that you can go and feel safe and still get preventative care. If you're sick, there are places that can take care of you. But also I would encourage everyone to think about the bigger picture too. And the idea of a medical home is that we take care of many, many needs that you have. Like what I said, dental, vision, taking care of families, and really being a trusted source for your health.
I think it's great that with everybody on here, there's so much information out there, and simply saying I don't have insurance, so I can't have health care, it's just not true. So you can absolutely find the care that you need. You just kind of have to look for it, and just like Mr. Fry said, be your own advocate. Find that information. It's out there. Just dig a little deeper, and if not, contact one of us. We'll be more than happy to point you in the right direction.
I agree. You have to shop around. There's a huge variation in terms of cost for these imaging studies. So, you can find places that will offer them for less. The federally qualified health centers, the county programs, and even some of the charity clinics in town. I mean, they're there with excellent clinicians that'll be happy to help and work with you.
What was that old Captain and Tennille song? You better shop around.
Yeah.
Pearls of wisdom right there.
You're dating us a little bit. But
I know,
true.
I can't help it.
It's all good. When I was saying dig a little deeper, I couldn't help but think of Princess and the Frog. Oh God, I've got kids. I'm sorry.
There you go.
Well, fantastic. Thank you so much, everybody, for joining us. We want to thank all of our panelists and, of course, all the participants, all of you guys for joining us tonight. We hope we were able to answer the questions that you really want answers to, the ones that have been burning inside. And this is such a huge topic. Dominique, I'll leave it to you to close us out.
Thanks, Bill. I have found this to be such an informative hour, and I really hope that we pointed our viewers in the right direction for them. And I think you guys offered such a wealth of information and a lot of hope to people in a time when there hasn't been a lot of hope. And I think that's really important. And I'm glad that these Ask To sessions are about that, about giving people hope. So if you have a question that wasn't answered, or if you just have more that you need to know about, please feel free, submit your questions on our website at click2houston.com/ask2. And we promise we will put all the resources in the website, in the article there. If you registered for tonight's event, you'll be able to get all the information that we've talked about. So thanks again, panel. You guys are amazing, and we really, really appreciate your time. And our audience as well. Thanks for being with us.
Thank you.